Now you can welcome.
Okay. Good evening, everybody. I'm welcoming all to our today evening's program. I request Surendra sir to conduct the session first. Surendra sir, please continue. Good evening, sir.
Thank you, Mr. Arup. See, we are facing very harsh and hot summer,
Yes, sir. Yeah.
whereas in Kerala it is pouring like anything.
I was there last 2-3 days back. It was literally like two different
Yes.
places. Yeah.
If it has not continued in Karnataka,
Yeah.
if it is continued in Karnataka, metro will, water will flow into metro.
Yeah.
Of course.
So we can hope some cooler days. In a few days,
Yes, yes,
Chennai will be colder.
Yes.
Yeah.
So things happen like that. The thing is, we are not able to sit even in the shadows.
Shade of the trees. Yes. Trees are in the
Burning.
shade. Yeah.
Burning like that.
If you are under the shade of a tree, you will be feeling
This
better.
year it is somewhat higher, and I don't know what will be the consequences in the future, because day by day the environmental changes causes a lot of disturbances for us. Because we have to be facing this onslaught. We have no other choice. Okay. Today I am going to give you some discussion about thirst. See, summer thirst is different from other thirst. But even then, medically we have been advised to take about 500 ml water every day and even more. Why? Because the circulatory system, lymphatic system must work together so that it will eliminate the morbidity from the body. So there will not be any difficulty for us, etc. Thus, for large quantities of water during fever, that we can recommend for aconite. Thirst absent with a swollen throat, mumps and other things, fungus infection. Thirst is absent. Apis mellifica. Unquenchable thirst, drinks often, but little at a time. You all know, Murthy has said several times. Can you guess? It's arsenicum or? See, arsenicum is a very, very great boon to the homeopaths. It comes in useful for many problems. Everybody knows about it. Even common men now say, in COVID fever and other things, he says arsenic album, sir, I have taken, sir. Like that they say. So in fact, homeopathy has become more popular after these COVID problems. Absence of thirst during fever or even without fever, the thirst is absent. If it is heat and redness, belladonna, and other conditions, Aethusa cyanotic. Thirst for large quantities of cold water and also for long intervals, bryonia. Light thirst in fevers or absence of thirst, gelsemia. You take gelsium during winter fevers, etc. Lilium tiglitum. Drink often as much as possible. He takes drinks. Drinks water. I am only telling you about water, not other things. Peculiar symptoms of intense thirst is a lot of saliva in the mouth. So, generally when thirst is there, saliva is absent. Mouth will be dry. Here, saliva is there, is a peculiar symptom, and you get intense thirst, mercurius solubilus. Unquenchable thirst during chillness is also a peculiar symptom. You see, during chillness, you don't feel like thirst, but Natromore helps in that condition. Craving for ice cold water and cool drinks. Want to take cool drinks often, that is chilled water, etc., etc. I can see many of them buy only very cold water, very, very cold water. This bottled water, Bisleri and other things. They take only chilled water. They touch it and chill. No, it is not chill. I want still chill. Vodosmodine is the medicine. Their desire for icy cold water, but it's vomiting out as soon as it goes into the warm stomach. See, you give milk to the child. When the milk goes into the stomach, she vomits. That is Yetusa cyanotype. Whereas, desire for ice cold water, but vomits when the water touches the stomach, phosphorus. Amygdalus persica also comes. Amygdalus persica. Thirst alternative with thirstlessness. Sometimes you feel thirsty, sometimes you don't feel thirsty. You yourself will wonder. Phycalocta comes. In spite of dryness in the mouth, there is no thirst. That is another one peculiar. There is saliva in the mouth, but no intense thirst for water, but saliva in the mouth. Merkson. Whereas dryness in the mouth, there is no thirst, but thirstlessness is nearly with all complaints. If you examine the patient, all complaints lead to thirstlessness. Pulsatilla is the medicine. Think about pulsatilla. When you take heavy food, it is not digestible. Water from the whole body goes to the stomach. Wanted to help the stomach for digestion process. That is why mouth becomes dry. Mouth becomes dry. Pulsatilla is the medicine. Here, it may be with heavy food or without food. Pulsatilla is the medicine. Thirst for large quantities of water, dry mouth and throat, but crave for milk. He feels better than milk, better than water. Milk better than water. Rustards. For children constantly drinking water, children taking water constantly. This is a deep problem. That is, tuberculum has to be thought of. Exhaustion, overwork, worry helps people suffering from sciatic pain, backache, pains related to nervous system, phosphoricum acidicum. Of course, with or without thirst. Acute inflammation of the skin, sunburn, inflamed gums, Medsol. You toothache, we suggest Medsol. Acute emotional stress and worry, grief, embarrassment, Ignatia amara. Like this, problems persist for us. Eruptions.
Why?
It's also a great problem. Sometimes they notice it, sometimes they don't notice it. Eruptions in blotches and itching, oozing, graphic syndrome. Crusty eruptions, hard eruptions. How does crusty eruptions indicate? Like flakes. See these flakes, fried flakes of eruption. Crusty. They are hard. Ranunculus bulbosus. Crusty eruptions, sometimes after abuse of kali iodide, mercury can be suggested. See, only when we know the history of the person, where you say abuse of kali iodide, then you think of mercury. This is a long drawn treatment under which you would have given kali iodide, but it would not help or not as quick as you thought of, then we change the medicine to mercury. Herptic, circinate, springy eruptions. Herptic, you know, herptic zoster. Circinate, circular eruptions on the skin. Spring eruptions, that is, they come with some force, then go down, then again come back. Sepia is the best medicine. Herptic patches, brown in color, sepia. Eruptions, itching patches, bleeding after scratches. We have been telling you time and again, sulfur is the best medicine. You scratch, and you bleed. Sulfur is the medicine. Eruptions, rash, receding in eruptive fevers. Then it will not be there, but again it comes up. Bryonia. Rash, slow evolution of rash, that is, they will erupt, they will be slowly subsidizing, again slowly erupting, again and again. Striking example is this summer eruptions. Summer, see, you don't get it all unless you are frequent mover in the sun, where they get the summer eruptions, the entire body. Apis mellifica is also best medicine, but eruptive problems, Bryonia is the best medicine. Eruptions, rash, slow evolution, rash in eruptives, Bryonia is the medicine. Eruptions, urticaria, cold bath from taking eruptions, Dulcamera, urticaria, wet becoming eruptions. That is, you are frequently in the habit of using water, that is, dishwashers or persons who pump water, clean the sump or clean the lines, water supply lines, etc. They got urticaria. For them, rust up is the best place. So these are all simple tips on eruptions. Yes. I'll give you some philosophy and hand it over to Dr. Anup. In acute cases, you see striking aggravations unless it is very severe in the patient or is near the death dose. The problem is acute condition. Seldom striking aggravation. Again aggravation comes in. This can be there in any part of the body. In the stomach ache comes in. Acute colic, slowly it seems to be stagnant or receding. Again it erupts. That's what the author Kent means. Acute but seldom see the striking aggravations. Again it aggravates again. Any part of the problem, any part of the body, etc. Unless it is very severe, mere pain, all right. But pain in the heart region, pain in the head, pain in the ears, pain in the stomach, pain in the kidney region, pain in the liver region. Of course, it's very difficult to find out pain in the liver region because most of the pain in the liver is not visible, but it shows its presence by backache through nerves. So we can say that the patient is in the death door, is leading to problems, severe problems. The longer the acute, then suitable remedy has to be thought of, and stronger the aggravation will be. The more the acute condition, the more aggravation, you have to think of stronger medicine. If the disease has resulted in tissue changes, then you see the striking aggravations. Even in the aggravation, it cannot be recovered. We know that tissues means not only internal, external also. But sir, how do we know internal aggravation? It can be thought of only by pain. But in some cases, it can be revealed to the surface of the skin. When there is a deep-seated condition, or when the order is re-established, vital force begins to help them, clean them, force them, attack them. Whereas drug cannot do this. You may ask, then why do you take drug? We take drug to support the vital force. That's homeopathy philosophy. It is done by vital force itself. The drug turns the economy to order. Economy to order. It is what you administered is medicine to the body based on the symptomatology. based on the totality of symptoms, based on the conditions of chronic condition of the aggravations, ameliorations, as the case may be. So they go and help the vital force. Don't worry, Baba, I am here. You go and fight. So vital force gets rejuvenated, gets more force than the disease condition, then attack the disease. This is the simple truth and philosophy. That turns the economy to order. Economy means the administered medicine. And then the vital force produces symptoms necessary to reverse the damage. Not only that, vital force attacks the aggravations, it also helps you to rejuvenate the skin problem. That is wherever damage is taking place. Of course, it has been supported further by medicine. By medicine. If the physician cannot look upon the re-established order and bear it, he will have to do. That is, the aggravations, the problems, recurrences have been brought down, attacked by the economical administration of the medicine to the vital force. Vital force attacks, make the condition normal. Then the physician must foresee these conditions, observe it when the patient comes again. If he doesn't do it, again giving the same problem, medicine, the patient is put to trouble. That is what Kent says. When the specific medicine relieved the condition, relieved all the problem. Now the skin is now healing. Now the patient is digestion condition is becoming normal. When he taken chapati or idli, as the case may be, hereafter he was taking only liquid food. Now he is taking hard food. He is able to take soft fruits. The physician must force, yes, his aggravations have been abated. Now he must give medicine to induce the present problem and strengthen further the organ itself, either the skin or the stomach or the etc. We must discriminate between the reaction and the need for the remedy. Very beautiful sentence. We must discriminate between the reaction and the remedy. And the need for remedy. Reaction, what is reaction? The medicine that you administered rejuvenated the vital force, expels the aggravations, expels the disease force, then you have to see the patient is required to needed the remedy for healing of the skin or softening of the stomach, strengthening the stomach muscles, etc. Like a podium, carbonate, assisting digestion and making digestion normal by giving china now and then to avoid loose motions, etc. If the patient presents with the violent reactions, then our remedy is wrong. Following remedy, we have done it wrong. Feeble patients with low vitality will present this problem also. Either you have done wrong or the feeble constitution with low vitality. Also he may present because he cannot recruit. So for him, you have to be more careful in administering the medicine prolonging the treatment, making him normal. Fewer symptoms are not specific, you have to give more symptoms. That is medicine based on symptoms. Enough to find a truly specific remedy. So, the homeopathic followers have not at all given a go-by to all the problems that has erupted into the disease. What is to be given to rejuvenate the vital force? What is to be followed to soothe the conditions? Okay. Thank you very much. Mr. Anup, please stand.
Thank you, sir. Thank you, sir.
Anup Kumar sir, you can take.
Yes, sir. Thank you. Today, we will be discussing prostate gland in detail, and this will be a little technical, but you will have a lot of information. And at the end of the session, I am also giving homeopathic remedies for prostate enlargement. So we can go into that. So prostate gland, by definition, is a musculoglandular structure. It is having a muscular structure, and it is also glandular also. That means it is secretory, and also it has a body. It's situated between the neck of the bladder and the external urethral sphincter. So there is the sphincter which is controlling the urine from the bladder. So it is around that and surrounded by the prostatic urethra. So it's around this urethra, prostatic urethra. It's conical in shape. The prostate gland is located just below the bladder in men and surrounds the top portion of the tube that drains urine from the bladder. So that's what we said. That the mouth of the bladder is surrounded by this prostate gland, and the prostate gland's primary function is to produce a fluid that nourishes and transports sperm. So mainly it is having a reproductive function, and it is seen only in men. So by the picture you can see it is located just below the bladder. This is the bladder and this is the prostate gland, and it is the urine actually passes through a tube, the extension of this urethra through the prostate gland. So it is like that. So when it is enlarging, it creates a lot of problem which we can discuss. So anatomically we can have the structures. Then there are three surfaces for it. That is anterior, posterior, and inferior lateral. That is, inferior lateral means below and aside. So that is the meaning of inferior lateral. So there are three surfaces for that, and it is consists of 5 lobes: the anterior lobe, posterior lobe, median lobe, and there are 2 lateral lobes also. So there are 5 lobes, and the size is about 3 centimeters vertically, 4 centimeters transversely, and at the base that is 2 centimeters anterior posterior base. So this is the basic shape and size and position of the construction of the anatomical details of the prostate gland. So by the picture you can see there are 3 the lobes are there. The median lobe is there, the anterior lobe is there, then you have the lateral lobes, 2 lateral lobes, and then you have in the lobe you can see there's a hole through the prostatic urethra passes, and this is the basic prostate gland picture or the structure. So by weight, if you measure, the normal prostate gland is around 15-20 grams, and please note, like the adenoma, the cancer, the adenoma usually occurs in the median and lateral lobes of the prostate gland. It never occurs in the anterior posterior lobe because they are mainly fibromuscular tissues and devoid of glandular structures. So glandular structures happen, adenoma happens only in the median area. And the facial relation is prostate gland is related to 2 capsules, one is and the fascia behind. So these are all the more details about the anatomy. The capsules, there are two capsules formed by the condensation of prostate in the periphery. False capsule is there, found in the visceral layer of the pelvic fascias, and prostatic venous plexus lies between these capsules. Then there is a surgical capsule formed by the non-adenomatous tissues of the prostate, which is pushed by hypertrophied gland to the periphery. So these are all too technical, but anyway, I'll go through that. Fascia behind the prostate is known as the Denivillier's fascia, and it is retrovesicular prostoperitoneal layer. It's Denivillier's fascia. The structures of the prostate gland, inside and around the prostate gland is there. Urethra is divided into three parts. Now, prostatic urethra, that is the widest and most dilatable part. Then membranous urethra, it is short and least dilatable, and then spongy urethra. So these are the all these three portions of the urethra are seen inside the prostate gland, and it is a continuation of the bladder where urine passes through the urethra. The sphincters are there. Internal sphincter, sphincter vesicae is at the neck of the bladder, and external sphincter or sphincter urethrae. So there are two sphincters which is passing on the urethra, which is the internal and the external sphincters. So when you see the diagram, you can see this is the prostatic urethra, and this is the membranous urethra, and inside will be the non-dilatable part of the urethra, and this is the prostate gland. So again, prostate gland, and these are the other organs of the internal area of the male human being. Okay. Now the relationships between the bladder base and the neck of the bladder. Inferior and external urethra sphincter is there. Posterior it will be the Denivillier's fascia, and lateral side will be lateral ani. So these are the relations where on the base side you have the base of the gland, you have the neck of the bladder. Inferior side will have the urethral sphincter, then the Denivillier's fascia, and lateral side will have the lateral ani. Then the blood supply is from internal iliac artery, and the venous drainage is the same as via posterior venous plexus, but some drainage also occurs in the valvulus vertebral plexus. So there is some through the vertebral plexus also some blood drains back, and this is the reason why when there is a cancer of prostate gland, the bones, the vertebral column also gets cancerous, because the cancerous blood also passes through that valvulus vertebral plexus, and that is the reason of a lot of other complications. The lymphatic drainage is internal iliac lymph node. So these are the vascular details of this blood supply and lymphatic drainage and all of prostate gland. So now physiology. Physiology of prostate gland. Testicular hormone regulates the prostate. So the prostate gland is regulated by the testicular hormone, the testosterone secreted by the Leydig cells of testis. In the absence of both the testes, the testes are removed. That is one of the treatments for prostate gland cancer. They remove the testes and to reduce the enlargement of prostate gland. So both the testes are removed. That means the enlargement of the prostate stops. The development of prostate fails. Prostate secretion is one of the next function. Prostate secretes specific fluid called prostatic fluid, which provide 10 to 20% volume of the ejaculated semen. It contains prostaglandin, enzymes, and acid phosphatase. It has antibacterial property, which helps to prevent UTI, urinary tract infection. So these are the additional functions of prostatic fluid. It contains the prostaglandins and acid phosphatase, which is antibacterial in property, and it prevents urinary tract infections for men. Prostate gland also secretes glycoproteinaceous fluid, which is known as the prostate-specific antigen. This is the important antigen which is checked during cancer examinations and evaluations. So the PSA, prostate-specific antigen, actually liquefies the semen and allows the sperm to freely swim, and it is the best tumor marker for prostate gland cancer. So if there is excess of this, then there is a chance of the gland is cancerous. If it is a normal level, then there is no problem. So this prostate-specific antigen has the function of making the semen thin and liquefying it and allowing the sperm to swim out of that freely. So normal values of PSA, if I told you, is 4 nmol per million per ml. It is normal. If it is 4 to 8, there is a benign prostate hyperplasia. That is, prostate gland is enlarged, and for most of the people, it will be 4 to 8. Because and the adult, after 40, 50 years of age, it can be benign prostate hyperplasia, and it will be 4 to 8. When it is 9 to 10, then it is it is either in the benign prostate hyperplasia, or some cancerous suggestions can be suspected. If it is more than 10, then it is suggestible for cancer. So if the PSA is above 10, then we should be careful, and we should do further studies whether it is cancerous or how to go about for the treatment. So this is an important information about the PSA and its values. So now, benign prostate hyperplasia is the histological pattern of prostate characterized by proliferation of the smooth muscles and epithelial cells within the prostatic transition zone. This may lead to prostatic enlargement. So when these cells multiply, the prostatic enlargement happens. It is considered to be normal part of aging in men, and it's hormonally dependent on testosterone and DHT protein production. So this enlargement is normal in old people, older men, and it is dependent on the testosterone availability. 50% of men develop benign hyperplasia by the age of 60 years, and 90% of people by the age of 85. So this benign prostate hyperplasia will be 90% in people after age 85, and after age 60, 50% of the people will have this benign prostate hyperplasia. So what happens when the prostate enlarges? So when it is normal, you can see the shape of the bladder is proper and like a funnel. Everything what is inside the bladder will flow through when the sphincters are open, it will flow out of the bladder. But when it is when benign prostate hyperplasia is developed, and that is prostate enlarges, you can see the shape difference also, size difference also. It is enlarging and pushing the bladder upwards, and the funnel shape is distorted. And because there is like a valley-like area, some vessel, the holding capacity is on the outside. Even when you feel you have evacuated fully, there is old urine left behind here. This is called urine retention. And this urine retention, if it is more, then there will be infections and all. So this is one of the symptoms for and bad effects of benign prostate hyperplasia. So causes, it's an involuntary hyperplasia due to disturbance of the ratio and quantity of circulating androgens and estrogens. So when the androgens and estrogen levels changes, then the prostate gland started enlarging. Then benign prostate hyperplasia is benign neoplasm, also called as fibromyalgia. So it's a fibromyalgia because fiber and muscle and adenoma is happening to that. So it's benign. It's not yet cancerous yet. So it's called fibromyalgia. With age, thyroid stimulating hormone levels drop. So this is another important reason. With age, thyroid stimulating hormone levels drop slowly, but fall of estrogen levels is not equal. So the thyroid will drop, but estrogen level is not equal. So prostate enlarges through intermediate peptide growth factor. So when estrogen is available and the thyroid stimulating hormone is low, the peptide factor is stimulated and the growth of the growth of the prostate gland happens, and the benign prostate hyperplasia is formed, developed. Benign prostate hyperplasia arises from the submucous mucosal gland of the periurethral transitional zone with a stromal proliferation and adenomyosis. So these are the reasons why it is multiplying, and eventually it compresses the peripheral zone and enlarges the lateral lobe. So here it enlarges and compresses the lateral lobe, and benign prostate hyperplasia arising from subcervical gland of the central zone enlarges as a middle lobe projecting up into the bladder. So the growth happens in a specific pattern. The sides enlarge and the center also enlarge and push upwards, and it displays the shape and size of the bladder. So, what are the common symptoms of enlarged prostate hyperplasia, the enlarged prostate gland? The urine stream, when we are young, we can urinate very far off from what we are standing, but when we go older, the urine stream, the pressure, the power of the urine stream comes down, and urine will fall just where we stand. So that is the weak stream of urine. Then difficulty in starting urination. So even if you want to urinate, you stand there or wait for urine to flow. It is difficulty in starting the urine. Then stopping and starting while urinating. So while you urinate, the urine naturally comes down and stops, and then after some time it will start again. So this is another symptom of prostate gland enlargement. Then dribbling at the end of the urinating. So after you stop urinating also, there will be a few drops of urine which is dripping out of the tract, and it is called dribbling at the end of the urination. And then straining while urinating. So you have to apply force to pass the urine. So this is another symptom of the prostate gland enlargement. Decreased frequency of urination, increased frequency of urination at night, nocturia. So at night when you lie down, you are forced to wake up 2-3 times at night, because you are not normally evacuating the full urine in the bladder, and the bladder gets full frequently, and you are forced to go out to pass urine frequently. So that is nocturia, and that is another symptom. So then the other thing is urgent need to urinate. You feel like you should urinate, and it is very urgent, you can't hold on. So that is one of the urgent feeling to urinate. Then frequent need to urinate. So even after you urinated in some time, again there will be a feeling of bladder full, and you have to rush to the urinate again. Maybe you will be passing small quantities of urine, but frequent need to urinate. Then not being able to urinate is the other thing. So even after the bladder is full, you will not be able to pass urine. That is another symptom. Then blood in urine, hematuria will be seen in some people. Then urinary tract infection is also there. Pain in the perineum. Perineum is the area between the anus and the scrotum. There is a small area that's called pain. That is called perineum, and pain there, which is often made worse by prolonged sitting. So if you are sitting long, that area will pain more. So that is another reason of UTI. Then pain in the pelvis and genitals and lower back and buttocks. So pain in the pelvis area, genitals, lower back and buttocks is another symptom of enlarged prostate. And pain when ejaculating. So that is also another symptom of enlarged prostate gland. So now we will see how they examine doctors examine and through the rectum and find the size of the enlargement. Through the examination, the upper size, the upper pole is easily, the upper pole of the gland is easily reachable with difficulty or not reachable. So that will be the deciding factor of the size. If the size is, they can touch the upper pole of the prostate gland through the rectum, that means it is not very bad. But if it is not reachable, then it means it is enlarged very much. Then next is consistency. If it is rubbery, soft, firm or hard, is the consistency which they check. If it is hard, it is really in pressure. Soft means it is not too much grown. The next is rectal mucosa is gliding or fixed, so that when they move the fingers, if the rectal mucosa is gliding or is it tightly fixed onto that. That is one thing which they feel. The surface is smooth or nodular. If the touch the surface of the prostate gland, if it is smooth or if it is nodular, that is what they check. Then tenderness or absent or present. So if you touch the pain or is absent or present is what they check. Then median scalus, that is there's a line between the lobes, and if they touch that and if they can feel that or if they cannot feel that, it is obliterated. That is what they will be checking when they use the rectal examination. So, as per the rectal examination, the size can be graded into 1, 2, or 3. The upper pole is easily accessible is called 1. The upper pole reachable but difficulty is called grade 2, and grade 3 it is not reachable. So, when the upper pole of the prostate gland is not reachable through rectal examination, it's called grade 3 prostate gland enlargement. So, and by weight, if it is by around 18 to 20, it is normal. If it is up to 25, it's called grade 1. It is up to 50, it's called grade 2. Up to 70, it's called grade 3. And up to 80 grams by calculation, they will say it is grade 4. And above 80 gram, it is grade 5. So these are all for record purposes and for studies and for data. They find all these detailed information. So this is technical information which we have on this benign prostate hyperplasia. So changes in the urethra, enlargement of prostatic urethra. That is the urethra within the prostate gland will be enlarged. Exaggeration of normal prostate curvature of the prostatic urethra. So the normal curvature is straightened or exaggerated. It will be more deeper. The curvature will be more bent. Then urethra compresses laterally, reducing the anterior procedure slit. So urethra, the tube is compressed from inside and it becomes narrow. Then changes in the urinary bladder. Compensatory hypertrophy or the vesicle of deep Teucer. That is, there is a hypertrophy of the areas in the urinary bladder. Then the urinary bladder wall becomes thicker. Hypertrophy of the trigone, the shape, the funnel-like shape is hypertrophied. It is not there. The formation of diverticula, that is when they push about, there will be vessel-like shape on the bladder under because of the pressure. It's diverticula, and formation of pool of residual urine. And cystitis and calculus all will be seen inside the bladder. Diverticula is small tubular extensions of the bladder because of some deformations there. So that is also another problem of the bladder. So this formation of pool of residual urine will be there. That is why we have retention, urine retention, and it ends up in cystitis, that is bladder infection, and stone formation also. So changes in the urethra and kidneys, ureters and kidneys. Hydroureter, when the ureter gets bigger than normal due to backup of urine. So when the ureters that leads to the urine, take the urine to the bladder, and when the bladder pressure pushes the urine back to the ureters become larger, and that is one of the causes of this benign prostate enlargement, and it's called hydroureter. In hydronephrosis, the condition where both the kidneys become stretched and swollen as the result of buildup of urine inside them. So hydronephrosis is urine backs up into the kidneys because the bladder mouth is constricted, and that becomes hydronephrosis, and the kidneys become swollen. Then vesicular ureteric reflex. This condition in which urine flows backwards to the bladder, from the bladder to one or both ureters and sometimes to the kidneys. So this is called vesicular ureteric reflex. Then chronic pyelonephritis. That is a bacterial infection causing inflammation of the kidneys. So these are all the problems which affects the kidneys and ureters. So you can see the normal, and when this ureter is normal size, but when there is moderate benign prostate hyperplasia, there is a moderate passage, and when it is really advanced stage, the opening you can see is almost not there. It's totally closed, and that means the pressure will build up inside, and you can see the ureters and all are pushed backwards. So, and here, like you can see some diverticulum forms. These are the pouches, extra pouches, which is seen, which will hang out of the bladder, and these are called diverticula. So another picture, diverticulars are seen here. Normally, in normally healthy bladder, we don't see any diverticula, but in this, when the prostate gland enlarges, the bladder is distended. Urethra is almost completely obstructed here. You can see it's obstructed totally. These are the reasons, because the mouth of the bladder, the bladder is totally tightly held by this enlarged prostate. So prostatitis, there are types. There are two types: acute or chronic, and acute or chronic. There are two types of prostatitis. In acute prostatitis, the causes will be due to some instrumentation, there can be some acute this thing, and bacterial infection will be there because of handling. E. coli, Klebsiella, and Proteus bacteria are normally involved in that. Ascending infection from below, some infection which entered through the ureters can be the cause, and the bacteria can be Staphylococcus. Then hematogenous will be, it is Staphylococcus precise, and descending infantile, it is also another infection which will start from below. Then pain, frequency, fever, and chills and rigors. There will be the clinical features are, there will be pain, frequency will be urinary frequency, urine frequency will be more, fevers and chills and rigors will be there, urine retention will be there, perineal heaviness, and pain on defecation. So when you go for passing stools, you will have pain. Tender prostate on pre-rectal examination. So prostate, when you examine, it will be per rectal examinations. You will find it, the prostate gland will be tender. Initial fractions of urine is turbid, which is sent for culture, and we can send it for culture and sensitivity to see which infection is going on there. So the chronic prostatitis is caused by E. coli, Staphylococcus, Streptococcus, Trichomonas, and chlamydia. There is always associated with posterior urethritis. These are always associated with posterior urethritis. So epidermitis, inflammation of the coil tube called epididymis. Epididymitis. So it's at the back of the testicle there is coiled tubes called epididymis, and because of that there will be an infection, pain in the perineum, rectum, and lower back pain, and the leg pain also. Fever will be there. Sexual dysfunctions. Per rectal examination shows tender prostate. Prostatic fluid obtained by prostatic massage shows 15 to or more pus cells in the examination, microscopic examination. So prostatic abscess. So when there is abscesses, some voids like inside the prostate gland, this infection is separation and pus formation in the prostate gland. Presentation is fever, rigors, perineal pain, urinary disturbance, and tender feeling. Soft fluctuation flatulent swellings in the prostate gland or rectal examinations will be seen. Often presentation is maybe retention of urine. Total count will be increased, urine will flow, urine will show pus cells. Ultrasound is a diagnostic is used for diagnosis. Ultrasound is often done over the perineum also. Treatment is antibiotics, ultrasound guided aspiration, transperineal lithotomy, in lithotomy position, that is how they give the medicines. And suprapubic cystostomy is better in case of urine retention. So when you stand in, when you kneel down and put your head down and present yourself as if they are doing lithotomy or the suprapubic cystostomy, that will be the position for administering the medicines. After drainage, antibiotics are needed for longer period for 6 weeks to prevent recurrent infection. So after all these retained urine are removed, there will be antibiotics to be fed for a long time in the allopathic system. So it is lower urinary flow rate with the presence of this bladder outlet obstruction is another disease. It is a low urinary flow rate with the presence of high voiding pressure. When you use a lot of pressure and still the urinary discharge will be less. It is urodynamically confirmed entity, and it's diagnosed as urodynamic pressure flow study, and the flow rate will be less than 10 ml per second with voiding pressure more than 80 cm of water. So if you put high pressure also, less than 10 ml only will be discharged per second. Eventually, the bladder muscle is inefficiency, that is detrusor inefficiency occurs, causing significant residual urine. So after the muscles fail to evacuate, there will be a lot of residual urine inside the bladder. The cause of bladder outlet obstruction is benign prostate hyperplasia, bladder neck hypertrophy, or stenosis. Carcinoma, that is cancer of prostate urethral stricture, functional bladder neck obstructions. Effects of bladder outlet obstruction is acute retention of urine, chronic retention of urine, impaired bladder emptying uremia, infections, stone formation and hematuria. Ultrasound, renal function test, intravenous urogram, PSA are the investigations done, and management is by treating the cause of by cystoscopic bladder neck incisions and ureterotomy and transurethral resection of the prostate. It is the then carcinoma of the prostate cancer. This is the most common malignant tumors in men after 65 years. Carcinoma, cancer of prostate, occurs in the peripheral zone in the prostatic gland proper, that is commonly in the posterior lobe. So prostatectomy of benign prostate prostate hyperplasia does not confer protection against development against the carcinoma of prostate. So even if you remove prostate also, prostate cancer can happen because the small portion of the retained prostate also can continue the cancer there. Incidence of prostate cancer in men above 80 years is almost 70%. Microscopically latent, and tumors incidentally found either by transrectal or ultrasound guided prostate biopsy or by PSA examination. Early localized carcinoma, advanced local prostatic carcinoma, metastatic carcinoma either into the bones or commonly into other organs. So since bones and the prostate gland share the same blood vessel and there is no valves to protect that, the cancer can spread through the blood to the bones immediately and other organs also. Histologically, it is an adenocarcinoma wherein there is a loss of myoelliptical cell layers which normally surrounds the prostatic glands, and glands here appears in confluence. Grading carcinoma is based on the dedifferentiation as proposed by Gleason. So you can see first is the occult. Occult is it is diagnosed after investigation due to suspicion. Without any symptoms, it is investigated by suspicion. Second is tumor confirmed by prostate or local nodules. Then third stage is tumor involving capsule and or diffuse type. The fourth stage is the third stage is tumor involving seminal vesicle. Fourth stage is extension to the adjacent tissues. So these are the stagings of prostate cancers. So when it is in the last stage that is E stage, it is that is a fourth stage. It extends to other tissues also. So prostatitis and homeopathic treatment. This is what will be more keen to know. Benign prostate hyperplasia or other prostatic problems. The following medicines are usually used for treatment of prostate gland related issues. This is Chimaphila umbellata. This remedy is often helpful when the prostate gland is enlarged with urine retention and frequent urging. The persons may have the feeling that a ball is lodged in the pelvic floor or experience pressure, swelling and soreness that are worse when sitting down. So when this symptoms tally, Chimaphila umbellata is the right medicine. So next is pulsatilla, prostate problems with discomfort after urination and pain that extends to the pelvis or into the bladder, often worse when man is lying down on his back. The pain and problems will be worse when he lie down on his back, suggests the need of this remedy. So there may be also bland, thick, yellow discharge from the penis. The pulsatilla is usually suited for emotional individuals who wants a lot of affection and feels best in open air. So pulsatilla is for the symptoms listed now. So apis mellifica, stinging pain during urination that is worse when final drops are passing is strong indication for this remedy. So stinging pain is like bee sting, no? So apis mellifica is bee, honeybee. So the pain is like stinging, so I can tally that. And the prostate area is swollen, very sensitive to touch. The prostate area is swollen and when you touch it is painful. Person may feel worse from the heat and from being in warm rooms, with improvement from being out in open air or from a cold bath. So apis mellifica. Next is causticum. Urine escape when the person coughs or sneezes often indicates the need of this remedy. So his sphincter muscles will be weak, and when he coughs or sneezes, a little drop of urine can escape. Once urine has started passing, the person may feel the pressure or pulsation extending from the prostate to the bladder. So that is the feeling which he gets. Causticum is also indicated when sexual pleasure during orgasm is absent or diminished. So this is another indication for causticum. So there is no sexual pleasure for these people who require causticum, and they have chances of inducing a few drops of urine while they cough or sneeze, and there will be pressure felt inside the bladder. Clematis. This remedy is often indicated when there is swelling of prostate gland. Prostate seems to have the narrowed or tightened the urinary passage. The swollen prostate gland would have tightened the prostate passage and the urinary passage, so that urine will be the flow will be slow. The urine usually emerges slowly in drops instead of streams, with dribbling afterwards. So clematis is the medicine for dribbling after urine passes. Lycopodium. This remedy is helpful if urine is slow to emerge, with pressure felt in the prostate both during and after urination. The prostate is enlarged and impotence may also be a problem. People who need this remedy often suffers from digestive problems also, with gas and bloating, and have an energy slump in late afternoon. Afternoon they feel tired. So this is the lycopodium symptom and can be selected when the symptom tallies. Sebal cerulata, everybody knows about this medicine. For this one, enlarged prostate gland. a frequent urge to urinate at night with difficulty in passing urine, and a feeling of coldness in sexual organs. Suggest this remedy for suggests the need of this remedy. So if this symptom tallies, this is the remedy. It's sometimes also used in lower potencies for urinary incontinence in older men. So it is normally used in what we call in the Q form, the molecular form, but potentized versions also are used in older men for incontinence of urine. So Staphylococcus, this remedy is indicated if a man feels burning pain in his urinary passage, even when the urine is not flowing, and urine retention is troublesome. Men who are likely to respond to Staphylococcus are often sentimental and romantic, and may also have problems with impotence, most often caused by shyness. So this is the symptom of Staphylococcus. Another medicine is Tulja. When prostate is enlarged and the person has a frequent urge to urinate with cutting or burning pain felt in the neck of the bladder, this remedy may give good relief. After urine passes, a dribbling sensation may be felt. A forked or divided urine stream. Sometimes urine will go in two streams, not as a single stream. So forked or divided urine stream is sometimes seen with this remedy so it can be used for that. Next is Ferrum picricum, senile hypertrophy of your prostate, epistasis, frequent maturation, that is frequent urination at night with full feeling and pressure in the rectum, scanty frequent urination, smarting at the neck of the bladder and penis. So this is Ferrum picricum. Now there are patented preparations also for this prostate gland enlargement and prostatitis. Dr. Reckwick's number R25 is called prostate drops. That is a patented medicine. Then SBL has prostonem drops, which is also very good. That 10 to 15 drops in 30 ml of water 3 times a day for 3 to 4 months can relieve many symptoms related to enlarged prostate gland and prostatitis. So to familiarize, R25 picture is here and prostonem drops picture is here. We can select it if necessary, if needed. So this is all for now, and I'm concluding. Thank you for your patient hearing, and I'm just handing over to Murthy sir. Murthy sir?
Picricum can you use for female also?
This symptom, I think, like if symptom tallies, it can work, but we have to ask Murthy sir also. Murthy sir, any idea?
Yes, sir. Ferrum pic is one of the best remedy. It will not only cure that one, and it will protect and improve the prostate gland position at that age.
Okay, thank you.
But females won't have the prostate gland, so the treatment is specifically for male. But whether Ferrum picricum will be working for female, yes, also has to be found out.
Yeah, because for female also the umbilicus uterus some problems will be there. No, that's the reason I'm asking.
No, that is a different organ in total, but it's symptoms tally, and if you have to read more about Ferrum picricum, then we will see if it is working.
Madam, Ferrum picricum generally we will not give to ladies.
Okay, fine.
First of all, instead of that one, you can go for Ferrum picricum, old age people, and that too it is a secondary medicine. After completing the course, 1 or 2 weeks, what we will use now, even the R25 or SBL prostaton also. After that, if the residual is there, still 20% not cured, 30% not cured means at that time if you give, it will set right the other medicines what it has done. Till that it will keep. But it is one of the best remedy for the old people. That too preferably gents.
Oh, okay. Because actually I have why I am asking night time that frequent urination is there. So along with the castricum and other medicines, shall we give for Ferrum pic also, like that I am asking?
For that it is excellent. What is the age of that patient?
65.
Then you can go for Lycopodium, Sarsaparilla, Equisitum, Pulsatilla. And one more thing, before giving that medicine, who are having night frequent urination, what other therapy medicines they are taking, preferably allopathy. If they are taking any diuretic medicines, we should not interfere in that.
Okay, sir.
Only you have to ask them the medicine what they are taking in the night at 8 o'clock or 9 o'clock, better to take at 6 o'clock.
Okay, sir.
So some doctors they will prefer before bed. So these nowadays the people are going at 10 o'clock or 10:30. At that time they will put that medicine. So every 2 hours or 3 hours the urine will pass. Because the medicine will work at that time.
Okay, sir.
That we
Okay,
have to
sir.
see.
For elderly people, night urination, what the best idea is to reduce drinking water after 7 o'clock, and even after that also there will be frequent urination. What we should do is, if possible, they let them lie down on the bed for some time, and they can raise both the legs for at least 5-10 minutes in the first part before sleeping. Then all the urine or the liquid water retention in the legs will come back to the kidneys for filtration, and within first 1 hour itself they will pass out all the urine what is available for passing out in the first phase itself. Then second time they will not be forced to wake up and get up and go to the toilet again. So they have to raise their leg for 10 minutes and then wait for some time. They will be feeling bladder is full and they can evacuate it.
Okay, sir. Okay, sir. Thank you.
And one more thing is the mechanism of both male and female, even though it is similar, this cause can be different because of there is this urine retention can be because of the descending of bladder or the absence of the uterus after surgery or some sort of additional growth or something. So that cause has to be analyzed for females and why they are holding, why they are retaining urine, not like men, where men the specific causes prostate gland enlargement. For female, there will be various other reasons also.
Okay, sir.
So if you all the people, if you don't laugh, I will tell one thing. Previously in olden days, the aged persons, they will sit in a chair, just like a sleeping chair, and legs they will put on the hands of the seat. So many areas. In Kamala Hassan picture, Indian, if you see, this type of chair will be there, he will keep his legs there. By that way, the water content will not go to lower extremities.
Yeah.
It is one of the nice exercise and medicines we can reduce.
Legs hold a lot of
Legs are
water.
hanging
When you
means-
stand up, a lot of water is in the legs. So
Legs
when you raise it above your heart level, then it will be pumped back into the system. The venous, the lymphatic system will drain the blood water, and you will be freed out of your night problems when you do that. That can be practiced by everybody elder. Like any helpers can also raise their legs for some time and then put them back to normalcy. They can place a rolled bed or mattress or something by the side of the bed. They can keep it on that for some time, and then when they lie down, they can take their legs out of that.
Round pillows you can keep the legs on that
Which-
for minimum
which should
15
be-
to 20
which
minutes
should
in the
be high
night.
enough to above
Yes.
your heart.
Yes.
Stop
Anyhow,
taking water
Yeah.
after 6 o'clock or 7 o'clock.
Correct.
Take only little quantity.
yes.
Don't take too much water.
And the older people will have a lot of pills to have, so they will have to take some water, but they have to restrict it.
Yes.
Any doubts? If doubts are not there, please we'll close, sir.
Okay,
Anup
sir,
Kumar.
we'll close it up.
So next week we'll meet. Thank you very much, sir.
Okay, sir. Thank you all. Thank you all. We'll see you next week. Okay.